Caregiver Action Network, previously known as the National Family Caregivers Association, is proud to present Safe and Sound: How to Prevent Medication Mishaps.
Welcome to the National Family Caregivers Association's Safe and Sound: How to Prevent Medication Mishaps program. NFCA is the nation's leading organization for family caregivers, reaching across all life stages and diagnoses to address the common needs and concerns of all family caregivers. NFCA provides services and programs in the areas of education, community, and advocacy to help family caregivers build their confidence and capabilities so they can improve the health and well-being of themselves and their loved ones while simultaneously working to remove the institutional barriers that makes life so much harder for family caregivers than it needs to be. This presentation is designed to enable family caregivers to be effective members of their care recipients' medication management team, improve their adherence, prevent problems from arising, and be better stewards of their own medication health as well. We are grateful to the National Association of Chain Drugstores Foundation for sponsoring the development of this on-demand version of the Safe and Sound: How to Prevent Medication Mishaps program. Safe and Sound was originally created with the support of Novartis, Intel Health, Eisai, Home Instead Senior Care, Pharma, Genworth Financial, Health Services for Children with Special Needs, and the AmeriGroup Foundation. We hope that in viewing this program, you will be able to identify the members of your medication safety team, better understand when and where medication problems are most likely to occur, and gain valuable safety tips that, when implemented, will reduce the possibility of problems associated with managing your loved one's medications. People with chronic illnesses or conditions take more medications than anyone else. Medical professionals have a language all their own. Here are some terms relevant to medication management that you should familiarize yourself with. Medication adherence: the extent to which patients take medication, both RX and over-the-counter, OTC, as instructed by their healthcare practitioners. Adverse drug reaction: an unintended and negative reaction to a medication. Medication error: a preventable event that can lead to patient harm or inappropriate use of a medication. Medication reconciliation: the act of reviewing all of a patient's medications before ordering a new one to ensure that there are no overlaps or potential negative interactions. This program will cover the who, what, where, when, and why of medication safety. First, we want to look at who the key members of a medication safety team are. As the family caregiver, you and the care recipient are important members of the medication management team. Who are the members of the medication safety team? The team consists of doctors and other prescribers, such as nurse practitioners, physician's assistants, and specialists, pharmacists, who are specially trained to formulate and dispense drugs or medications, hospital staff, who dispense medication during a hospital stay, and case managers, who assist in the planning, coordination, and monitoring of medical and social services for your loved one. A whole network of individuals exists to assist you in the process of caring for your loved one, but it is sometimes up to you to begin the conversation. Naturally, you will have questions about things that you and your caregiver don't understand about medication management. This is where the medication safety team comes into play. Basic questions to ask are, should this medication be taken with or without food? Are there any foods that should be avoided while taking this medicine? It is important to know if one should take the medication with or without food, or what foods to avoid. For example, it is important to avoid drinking grapefruit juice while taking certain antidepressants, anti-seizure medications, and cholesterol-lowering drugs. The chemicals in the juice and the drug interact in such a way that they can cause potentially serious side effects. How long is the drug supposed to be taken? Find out if the medicine needs to be taken for the entire time as prescribed. Is there harm if a dose is skipped, or if all the pills aren't taken? What are the consequences? Pharmacists know more about medications than any other member of the healthcare team. Don't hesitate to ask them for advice and information. How much does the medicine cost, and is it affordable? Cost shouldn't prohibit you or your loved one from receiving needed medications. If you can't afford the medicine prescribed, find out about your options. If the medication is a brand name, ask the doctor and the pharmacist about generic. Consult the toolkit with this presentation to find out about medication assistance programs. There are many programs available to help you get medications at a reasonable cost. Knowing how your loved one will react to the medication prescribed is crucial. Is the medication working? Are there signs to look for? With the right information, you can monitor your loved one's symptoms to determine if he or she is indeed responding to the medication or if the medication isn't working. Ask questions such as, will his or her throat stop hurting? Or will the rash disappear? How long should we wait to see results from the medication? Another question to ask is, will this drug interact with medications currently being taken, including any over-the-counter medications, OTCs? To enable a member of the medication safety team to answer this question, they need your comprehensive medication list of both prescribed and over-the-counter medications or supplements your loved one is currently taking. The responsibility for creating and updating this comprehensive list falls solely to you and your care recipient, because most physicians' offices and hospitals do not yet have fully integrated electronic medical records. There is always a risk of side effects occurring when taking medication. Side effects can range from being unpleasant to potentially lethal. Knowing what to do if side effects occur is very important. Should you let them run their course? Do you need to consult with your doctor? Call the pharmacist? Call 911 or take your loved one to the ER? It all depends on the level of severity or nature of the side effects. When you get the medication, ask what can be done to avoid or minimize side effects. Are there other medications to avoid? There are some drugs that are bad combinations when they are combined. Take steps to prevent them from happening. For example, if stomach distress occurs, ask if antacids are allowed or if they will interfere with absorption of the medication. A very important member of the medication safety team is the pharmacist. Using one pharmacy rather than multiple pharmacies makes it easier to develop a strong rapport or working relationship with your pharmacist. If you haven't done so already, introduce yourself to him or her and tell them who you are caring for. Let them know that you value their advice and plan to come to them with questions that concern you. Some common questions are as follows. Can my loved one take multiple medications at the same time to prevent missing a dose? Or, will taking multiple medications cause negative interactions? What over-the-counter medications, OTCs, interact negatively with the prescribed medications? Ask why the medication looks different from the last time you picked it up. Is it from a different manufacturer or distributor? Also, be sure to ask about medication therapy management, MTM. What is it, and how can you access it? It can be a valuable resource in managing your loved one's medication. And remember, you don't need to have an appointment to see a pharmacist. The most important thing you can do to manage your loved one's medications and your own is to develop a medication list. The list needs to be current and comprehensive. Include any and all prescription and over-the-counter OTCs medications your care recipient is taking. Remember, the list is a tool to be used on an ongoing basis. A form exists in the toolkit that is part of this program. You can find others on the internet. The most important thing is to keep the list up to date, so find one that you think is easy to fill out. Although it doesn't contain every bit of information that it is recommended you include on a medication list, a very easy way to continually get an updated list is to have one printed out for you at the pharmacy. It is important to keep the medication list handy in case of emergencies. You never know when you will need to provide the list to a member of the healthcare team, or you need to access it yourself. When traveling outside the house, keep 2 copies of the list with you. Carrying the medication list along with insurance information enables healthcare professionals to be of assistance right away. Information about your loved one allows quick and easy access. Keep a list on the refrigerator so it is easy for emergency medical personnel to find. Also, place a copy in your care recipient's patient record file. For more information about what constitutes a patient record file, you can view our Communicating Effectively on Demand program. So, what information should be included on your care recipient's medication list? List all medications prescribed by doctors, but also list those purchased without a prescription, such as aspirin, vitamins, and herbal supplements. These over-the-counter meds can at times interact with prescription drugs and create serious problems. You are probably the only one who knows all the medications your loved one is taking, especially if he or she sees multiple physicians. 5 key pieces of information should be listed on the medication list at a minimum. First, the name of the medication. It is recommended to differentiate whether the drug is the generic or the brand name version. Second, the dosage of the medication. The strength of the pill and the dosing schedule should be identified. It is very important for you to be exact and to double-check the dosage to ensure this information is correct. Example, 10 milligrams twice a day. Third, what the medicine visually looks like. Is the medicine in pill, capsule, or liquid form? What color is the pill, liquid, or capsule? Are there any markings or writings on the pill or capsule? Is the pill scored? It is important to keep track of what the medicine looks like, so if you receive a medicine that looks different, you can ask your pharmacist why. This can prevent medication mishaps. Fourth, what condition was the medication prescribed for? For example, was the medicine prescribed to relieve pain, manage blood pressure, etc.? Fifth, potential side effects. You want to know what side effects can occur by taking this medication, so if your loved one is experiencing any of the serious side effects, you can contact the appropriate medical personnel. Tip: update the list whenever there is a change in the medication regimen. Additional information to be included on the medication list includes, for prescription drugs, add the name and number of the prescribing doctor and the name and number of the pharmacy that filled the prescription. This information is particularly good to have if your loved one is being seen by a new specialist or at the ER. It makes it easier for new doctors to contact another medication safety team member. Taking medication can be a complicated process. On the medication list, write down the instructions on how and when the medication should be taken. For example, how many times a day the medicine should be taken, once a day, twice a day, or on an as-needed basis, and when the medication needs to be taken, when you wake up, when you go to sleep, with a meal. You also want to be aware of what your loved one should not do while taking this medicine. Should your loved one avoid staying outside in the sun for a prolonged period? Should they not operate heavy machinery or drive a car? Should consuming alcoholic beverages be avoided? Remember, when certain prescription drugs are mixed with alcohol, it can potentially be a lethal combination. Finally, note any allergies or intolerances or other significant medical information that might not be obvious. Is your loved one allergic to penicillin? Did he or she have a significant reaction to a medication they were previously on? Did a previous prescription not work or make your loved one feel worse? Tip: be sure to put the patient's name at the top of the document and include your contact information as the person to call in an emergency. It is critical that you keep the medication list updated. Not only will an outdated record not do any good, but it may actually do some harm. A simple computer-based document you create yourself is one of the easiest ways to keep the list current. Ask why the medicine is being prescribed and what it is for. You also want to know the medication's limitations. When new medications are introduced, it is always okay to ask questions and trust your intuition if something seems off. Don't take any information that you receive for granted. You have the right to speak up. If you get conflicting information, ask more questions. Monitor your loved one for reactions, and at the first sign of trouble, call the doctor and report the specific symptoms you see. Be accurate and objective. Only record the facts and leave the diagnosing to the doctor. When communicating these symptoms with the doctor, you want to make sure you are communicating effectively. If you have others helping you help your loved one, make sure everyone's role is perfectly spelled out when it comes to managing medications. This will avoid missing, skipping, or duplication when administering medication. Devise a system and use various tools to manage your caregiver's medications on a daily basis. Using pillboxes is one of the easiest and most effective ways of organizing medication for you and your loved one. When someone is taking multiple prescriptions, it is sometimes difficult to remember what time of day they should take their medicine and how often. Perhaps you could use a pillbox with labeled compartments for each day of the week, but also with multiple rows for medicines taken several times per day. There are many products on the market to help us all organize our medications and take them when we are supposed to. The use of auto-refill programs is becoming more common as an effective way to help your loved one manage their medications more effectively. Once a prescription is nearing its refill date, you and your loved one can set up the medicine to be automatically refilled at the same pharmacy it was originally filled. This method saves you and your loved one valuable time and reduces stress by avoiding waiting for a refill, which can take minutes, hours, or days, depending on if they have the medicine in stock. Stress is reduced and peace of mind is achieved, knowing that the medicine will be ready for your loved one's use. Next time you go to your pharmacy, inquire how to take advantage of an auto-refill program. You want to pay particular attention to your family member's emotional health while taking medication. Changes in mood, diet, and sleeping habits are signs that something may not be right with the medication. Write this information down so that you can inform and advise the primary care team's approach to treatment and long-term planning. It is very scary when your loved one is taken to the emergency room or requires a hospital stay. Don't be frightened. Be prepared. Bring 2 copies of the medication list to the hospital. Make sure a copy of the patient's medication list goes into your loved one's file, and keep the other copy of the list with you at all times, should you need to access that information during the hospital stay. If you are unable to bring a copy of the medication list with you, grab all the medications, throw them in a bag, and take them with you. Bring a notebook or journal with you so you can write down any information or questions that you may have and follow-up that is needed. Be sure to make note of all of the information about what may have caused your loved one's symptoms and what can be done to prevent this problem from occurring again. Don't be afraid to ask for an explanation in language you can understand. It is your right and responsibility. The notebook is your version of your loved one's medical record. The information in it is important and can provide historical context when the doctors and nurses in the ER are trying to determine what happened. Keep this notebook with you throughout your time at the hospital. Whether you are at the pharmacy, in a doctor's office, at home, or even at the hospital, there are tips that can assist you in preventing medication mishaps. The following safety tips can help you prevent problems caused by interactions between medications, vitamins, supplements, and foods. It is one more way that you can be a good steward of your loved one's health. It is also a good example of what it means to be a proactive family caregiver. And while you are following these steps to protect your loved one's health, consider following them for yourself as well. Remember, your own good health will enhance your well-being. It is also essential for you to your being an effective family caregiver. Despite your best efforts to manage your care recipient's medication, a hospital visit might be inevitable through no fault of your own. The following are some tips, best practices that you should adhere to while your loved one is in a hospital setting. It is important to develop a good rapport with the hospital nursing staff. Having a good rapport will allow you to feel comfortable asking them for information on your loved one's condition. While your loved one is staying at the hospital, check to make sure he or she is receiving all of their regular medications, not just those that are related to the current situation. The medication list you brought with you needs to be placed in your caregiver's chart. If it isn't on the chart, there is no official documentation that tells staff it is okay to dispense those medications. If it isn't there, a nurse would have to get permission to administer the medication. If a new medication is prescribed for use after discharge, make sure you fully understand the new medication regimen and how it fits with the old medications before you leave the hospital. Ask for suggestions on how to incorporate the new regimen with the old one. Ask to speak to the hospital pharmacist if you think you need more explanation. Doctors are known for their hard-to-read handwriting when it comes to fill out written prescriptions. For that reason, don't be shy about asking all your loved ones' doctors to translate their handwriting so you can write down exactly what a prescribed medication is, its name, dosage, etc. Be sure you understand what the doctor says about the medication. Ask questions. You can have a cheat sheet of medication-related questions you always bring with you to appointments. You can keep them in your patient file. Look at your medications before leaving the pharmacy to make sure they look just like what you had before. If they don't, ask the pharmacist. Don't risk taking the wrong medication. If you leave the pharmacy with the wrong medication, the pharmacy may not be able to exchange it for the correct medication. Looking at the medication before you leave could save you money and time. On each medicine bottle, write down the name of the condition it treats. You might find that your loved one is taking 3 different pills for the same condition, each prescribed by a different physician. That may be exactly what is needed, but it is definitely a red flag to alert you to ask questions. By asking questions about why multiple medications are needed for a specific condition, you may find out that you can eliminate some medication because some of them are treating the same problem. Whether you are at the doctor's office or at the hospital, there are a few safety tips that should be adhered to in order to prevent medication mishaps. As discussed before, always bring a copy of a current medication list for the doctor's reference. If you do not have a copy of the current medication list available to take with you, bring in the prescription bottles themselves instead. As a family caregiver, you need to fully understand what is being asked of your loved one, and therefore you as well. Here are when medication problems are most likely to occur. These are the times you need to be most vigilant. When written, this is the start of the medication management process. If you don't have a clear understanding of the medications being prescribed now, the chances of a medication mishap occurring increases. That's why you can never ask the doctor or other person writing the prescription too many questions, and why you need to fully understand what you are being told. When filled or refilled, was the pharmacist able to correctly read the prescription? Did he or she take the right bottle off the shelf? Making sure you receive what was prescribed is a good way to prevent medication mishaps. When changes in medical conditions occur, often a new medication is prescribed or an old medicine is discontinued. Just by the nature of there being a change in the medication regimen, your loved one is at greater risk for having a problem caused by medication. You may not be able to prevent it, but you can be on the lookout for a negative reaction. When transitions occur, each time your loved one is moved to a new setting, from one floor to another or from the hospital to home, there are opportunities for medication problems to occur. Was all of the information about your loved one's situation and medications transferred to the new team? Will new medications be administered? You and the patient are the only 2 people who are consistent across all care settings. That's why it is important to know who will be in charge of your loved one's medication in the new setting. Seeing multiple providers. Since your loved one may well have multiple physicians, a primary doctor, and specialists, it is likely that each will prescribe a medication to treat a different medical problem you are having. You can't be sure that each provider knows what the other has prescribed and for what reason. The lack of coordination between physicians is the norm, and therefore it is up to you to make sure that each prescriber has the up-to-date medication list. Try to use the same pharmacy for all prescriptions. As a family caregiver, you have so much to do as it is. Why complicate things by going to multiple pharmacies? Go to a single pharmacy. Save time and reduce your stress. As mentioned before, a significant benefit of using one pharmacy is that a detailed record of your loved one's medication will be in one place, so you can get a printout anytime you want, and you can take advantage of any auto refill programs available. When you are purchasing herbals, supplements, vitamins, or any other over-the-counter medicine, make sure your pharmacist and doctor are aware of them. This helps avoid negative medication interactions. According to the National Council on Patient Information, between 40 to 75% of older people do not take their medications correctly. Some people hate taking medicine because they are afraid of the side effects that might occur. They might not take them because they forget, or they simply don't want to. Reinforce the need for them to take their medication so they can get better and feel better. Don't take no for an answer. Be strong. It is up to you, the family caregiver, to help your loved one be adherent. Care settings and/or members of the medication safety team can change at any time. Your family member or friend could go from living on their own to needing more care as they age or their condition worsens. Research indicates that medication mishaps are more likely to happen when your family member is changing care settings or providers. At any point, medical emergencies may arise and a trip to the ER becomes necessary. Sometimes a hospital stay is required. Then they might have to go to a rehabilitation center or even a long-term care facility, such as a nursing home or assisted living facility. When these care transitions occur, the family caregiver needs to make sure medications are being administered correctly in the new setting. Seek out the person coordinating the administration of medications. Build a rapport with that person, and make sure you have clear communication between the two of you. If new medications are introduced in any setting, emphasis should be placed on how they will interact with the old medications. Again, provide any new care setting with an updated medication list. As family caregivers, we play a significant role in ensuring our loved ones' safety as they interact with healthcare providers. We monitor their well-being and report symptoms. We advocate for their rights to treatment, and we manage their medications. We are the consistent team members that are constant across all settings. As the person with the most vested interest in your loved one's health and safety, you want to make sure they are taking the medication that will help reduce their symptoms or improve their functionality. This is why we do what we do. Remember, good health outcomes are 3 times less likely for patients who do not take medications correctly as compared to those that do. People with chronic conditions who don't have a family caregiver are less adherent to their medication regimens. Medication poses a huge risk to children and pets should they accidentally ingest them. You want to make sure you properly store and dispose of old medication in order to prevent harm to others. Most people think, I will get rid of unwanted, expired, or unused medication by flushing them down the toilet. Some can be flushed, but most medications should not be. Recent research indicates that the reproductive capabilities of various species of aqualife are being affected by the level of pharmaceuticals in the water. To dispose of medicine in a safe way, you should crush or dilute the medicine, place the medicine in a plastic bag, mix the solution with kitty litter, sawdust, or coffee grounds, seal the bag, and place it in the trash. Check with your pharmacist to find out how to dispose of certain types of medications. Ask if your pharmacy has a medication disposal program. Successful medication management for a family member or friend with a chronic illness means making sure they take all medications, both RX and over-the-counter, OTC, as instructed by their healthcare practitioners. The single most important tool at your disposal to make sure your loved one is safe and sound in their use of medication is to develop a comprehensive and up-to-date medication list. Remember to have 2 copies with you at all times and to provide all members of your medication safety team with updated versions on a regular basis. There is no such thing as a stupid question. If you don't know or are unsure, speak up and ask. Knowing what to do, how to do it, and having as much information as possible will empower you to help your loved one take their medication properly. NFCA has developed a downloadable toolkit that provides useful information about managing medication. The toolkit includes a sample medication list and offers other pertinent information. It may be found on the Attachments tab of this presentation. If you are interested in becoming a member of the National Family Caregivers Association, please go to our website at www.thefamilycaregiver.org. Membership is free to all family caregivers. As a member, you will receive the NFCA monthly e-letter, quarterly newsletter, the Education and Empowerment series of print pamphlets, as well as the support that comes from joining a community of others who walk in your shoes. Thank you for viewing this presentation on Safe and Sound, How to Prevent Medication Mishaps. We are grateful to the National Association of Chain Drug Stores for sponsoring this on-demand presentation of the Safe and Sound, How to Prevent Medication Mishaps program. We also encourage you to view our on-demand webinar entitled Communicating Effectively with Healthcare Professionals. This presentation can be accessed by clicking on the link found in the Additional Resources tab in the lower right corner of your browser.